Hello and welcome to our channel. Today we're going to dive into a very important topic, the warning signs of colon cancer. This disease is one of the most commonly diagnosed cancers and can have a serious impact on a person's health if not detected and treated in a timely manner. Colon cancer is a condition that affects the large intestine, which is an important part of the digestive system. It starts as small growths on the inside of the colon called polyps, which over time can turn into cancerous tumors. There are several warning signs that can indicate the presence of colon cancer, and it's important to be aware of them. That is why we're here today to share with you the 7 most common warning signs of colon cancer. So let's get started. Number 1. Changes in bowel habits. Changes in bowel habits can be a warning sign of colon cancer and can manifest in different ways. Here are some examples of changes in bowel habits that may indicate a problem. Diarrhea. This can occur when the colon is unable to absorb water properly, leading to loose or watery stools. Persistent diarrhea can lead to dehydration and should be addressed by a doctor. Constipation. This can occur when there is a blockage in the colon or when the muscles that control bowel movements are not functioning properly. This can lead to difficulty passing stool or passing stool less frequently than usual. Change in consistency of stool. This can include the presence of blood in the stool, which can be a sign of internal bleeding, or the appearance of black or tarry stools, which can indicate a problem with the digestive system. It's important to be aware of changes in your bowel habits and to seek medical attention if these changes persist. A doctor can perform tests to determine the underlying cause and provide appropriate treatment if necessary. Changes in bowel habits such as diarrhea, constipation, or a change in the consistency of your stool can be a warning sign of colon cancer. If you experience any of these symptoms, it's important to see a doctor as soon as possible to get an accurate diagnosis and proper treatment. Number 2. Blood in stool. Blood in stool is a serious symptom that should never be ignored. The presence of blood in the stool can indicate internal bleeding, which can be a sign of colon cancer or other serious health conditions. The blood can range from a small amount that is only visible when wiping to larger amounts that are noticeable in the toilet bowl. The color of the blood can also vary from bright red to a darker, almost black color. It's important to see a doctor immediately if you notice blood in your stool. They will be able to perform tests and examinations to determine the cause of the bleeding and to rule out any serious health conditions. The doctor may also perform a colonoscopy, a procedure that uses a camera to examine the inside of the colon to get a better look at the area and to detect any potential problems. In addition to colon cancer, other potential causes of internal bleeding include ulcerative colitis, Crohn's disease, diverticulitis, and hemorrhoids. That's why it's so important to see a doctor right away if you experience this symptom. They will be able to diagnose the cause and provide the appropriate treatment to help you feel better and to prevent any further complications. Number 3. Abdominal pain. Abdominal pain is a common symptom of many health conditions, including colon cancer. It can range from mild discomfort to severe pain and can be a sign of a blockage in the colon. A blockage in the colon can occur when a tumor or mass forms, which can obstruct the normal flow of stool and gas. This can lead to abdominal pain that can range from mild to severe, depending on the severity of the blockage. The pain can be constant or come and go, and can be accompanied by other symptoms such as bloating, constipation, and nausea. In addition to blockages, abdominal pain can also be a sign of other problems within the colon, such as inflammation or infection. The pain can be felt anywhere in the abdomen and can be accompanied by other symptoms such as cramping, bloating, and changes in bowel habits. If you experience abdominal pain, it's important to see a doctor for an accurate diagnosis and proper treatment. In some cases, the pain may be a result of a condition that is not related to colon cancer, but it's still important to rule out this possibility. Number 4. Weight loss. Unexplained weight loss can be a concerning symptom and can indicate a number of different health issues, including colon cancer. When the body is not properly absorbing nutrients, it can lead to weight loss as the body is not getting the energy it needs to function. This can be due to a variety of reasons, including a tumor in the colon that is blocking the normal digestion and absorption of food. In some cases, the tumor may also secrete substances that can lead to weight loss. It's important to note that weight loss can also be a symptom of other conditions, such as an infection, a chronic illness, or a mental health issue, so it's important to see a doctor for an accurate diagnosis. In the case of colon cancer, early detection is key to a successful treatment outcome. That's why it's important to be aware of this symptom and to see the doctor if you experience unexplained weight loss. Your doctor will be able to perform a physical exam as well as any necessary tests to determine the cause of your weight loss and to provide an accurate diagnosis and treatment plan. So, if you're experiencing unexplained weight loss, it's important to take it seriously and to seek medical attention as soon as possible. Number 5. Bloating. Bloating is a common symptom that can be a sign of colon cancer. It is caused by gas buildup in the colon, which can lead to abdominal pain and discomfort. This can make the abdomen feel full and tender to the touch. In some cases, bloating can also cause the abdomen to look visibly distended, making clothing feel tight and uncomfortable. Bloating is often caused by a buildup of gas in the colon, which can be due to a variety of factors, including swallowing air while eating, digestive problems, and certain foods that are known to cause gas, such as beans and lentils. However, in some cases, bloating can also be a sign of a more serious underlying condition, such as colon cancer. It's important to remember that bloating is a common symptom that can be caused by a variety of conditions, and it's not always a sign of colon cancer. However, if you experience persistent bloating that is accompanied by abdominal pain and discomfort, it's important to see a doctor for an accurate diagnosis. Number 6. Nausea. Nausea is a common symptom that can be caused by a variety of factors. In the case of colon cancer, nausea can occur as a result of a blockage in the colon that is preventing the proper digestion of food. This blockage can slow down or completely stop the movement of food through the colon, leading to an accumulation of waste and gas. The buildup of waste and gas can put pressure on the walls of the colon, causing discomfort and pain. The pressure can also stimulate the digestive muscles, leading to the release of digestive juices and an increased feeling of nausea. Nausea can also be a result of the body's response to the cancerous growth in the colon. The cancerous cells can release toxins into the bloodstream, which can affect the digestive system and cause symptoms such as nausea and vomiting. Additionally, the cancerous growth can press against the surrounding organs, leading to a sensation of fullness or discomfort that can contribute to feelings of nausea. Nausea is a warning sign of colon cancer that should not be ignored. If you experience persistent nausea along with other symptoms such as abdominal pain, changes in bowel habits, and blood in stool, it's important to see a doctor for an accurate diagnosis and proper treatment. Number 7. Jaundice. Jaundice is a yellow discoloration of the skin and the whites of the eyes, and it is a warning sign of liver problems. It occurs when the liver is unable to process bilirubin, a yellow pigment that is a byproduct of the breakdown of red blood cells, properly. When the liver is not functioning correctly, bilirubin builds up in the body and causes yellow discoloration. Jaundice can be a sign of a variety of liver problems, including liver disease, hepatitis, and liver cancer. It's important to note that jaundice can also be a symptom of other conditions, such as anemia or gallstones, so it's important to see a doctor for an accurate diagnosis. If jaundice is left untreated, it can lead to more serious health problems, so it's important to get checked out as soon as possible. In addition to jaundice, other symptoms of liver problems may include fatigue, abdominal pain, and changes in the color of urine and feces. If you experience any of these symptoms, it's important to see a doctor as soon as possible. These are the 7 warning signs of colon cancer. It's important to note that these symptoms can also be caused by other conditions, so it's important to see a doctor for an accurate diagnosis. If you experience any of these symptoms, it's important to get checked out as soon as possible. Early detection is key in the successful treatment of colon cancer. Thanks for watching. If you have any questions or comments, please leave them in the comments section below. Stay healthy and stay informed.